Hello everyone! I'm here to present one of our quality improvement initiatives, which is leveraging the Emergency Severity Index. More than 200 patients per day are being seen in our emergency department, and in order to prioritize such volume of patients, we use the Emergency Severity Index, or ESI, as our triage system. ESI simply means that those patients requiring life-saving interventions will be assigned with ESI 1. ESI 2 patients are those patients that are in high-risk situations, those that have altered mentation, whose vital signs fall under the danger zones, or who are in severe distress or in severe pain. ESI 3 patients are those patients that would require many resources to reach a disposition, while ESI 4 patients would require one resource to reach a disposition, and ESI 5 patients do not need any resource to get a disposition. So 6 months before the initiation of this project, we identified that a big bulk, or in fact the biggest bulk of our patients, which is 43% of them, are falling under the category of ESI 3. So our team identified a big opportunity to better stratify this group and to determine a better way on how to prioritize patients falling under this category. Some of them may be sick or sicker. So we have felt that need to better stratify this group. So we looked into our processes and we examined the value and availability of our own resources and how they all play out in terms of our patient population. So we have then come up with a new triage level, which is the ESI 3.5, which is intended to be assigned to those patients who would require less resources than an ESI 3 patients would need, but more resources than ESI 4 patients. So 6 months after initiation, we have seen the proportion of ESI patients break up, with 28% of our patients getting assigned with ESI 3. As I mentioned earlier, we got a big bulk, which is 43% of those patients falling under ESI category 3. Now, after implementation of this initiative, we have seen 28% of our patients getting into that triage level, while the other 17% of those patient populations post initiation of this project getting assigned with the new ESI triage level, which is the 3.5. So of those ESI 3.5 patients, more than 3/4 of them were discharged home or get the disposition discharged. So that simply means that, or suggests that these patients falling under the new triage level are less sick than those ESI 3 patients. That's what we have predicted before starting this project. So overall, with this initiative, our department have identified a better way to prioritize our patients. As to our next steps, one is to continuously validate and monitor our triage accuracy and continue to evaluate our measures. Next is to continuously explore solutions or better strategies on how to improve our care. Next is to potentially adjust and standardize our triage level labeling. And lastly, to present this to the organization or association which actually established the Emergency Severity Index, and hopefully ask them or solicit more advice on how to better move forward and look forward into having it larger scale. So that will be all. Thank you.